Hi, my name is Tasha, and I'm going to be performing the oral medication administration skill video. To begin, you do want to make sure that you verify all the orders from the provider. You do want to verify the 6 rights of medication administration, which is going to be the right patient, the right drug, the right dose, the right time, right route, and right documentation. You do want to make sure to check and verify the orders in the EHR as well, and I'm going to be using MAR1. The medications that we're going to use today is going to be the Docustate Sodium 100 milligram tablets, the Warfarin 5 milligram tablet, Furosemide 20 milligram tablet, potassium chloride, which is 28 milliequivalents, and then I'm going to have the liquid acetaminophen, which is the 500 milligrams per 15 ml. There is no dosage calculation needed. Everything is ready to go. I'm going to gather all of my supplies from the medication room. I'm going to knock on the door and enter the patient's room. I am going to place all my supplies and medications on a clean, dry surface. I will close the door behind me to provide patient privacy. I'm going to perform hand hygiene. I will introduce myself to the patient. I'm going to verify their first and last name and their date of birth, and then I'm also going to check the wristband, which makes it the 2 identifiers. I will also ask the patient about any allergies, medications, food, or even seasonal. At this time, I'm going to verify medications in the MAR for a second time. I am going to inform the patient what we are using these medications for. The Docustate Sodium is going to help alleviate the constipation. Some of the side effects may include some nausea or vomiting. Warfarin is going to be used to prevent any blood clots. Some side effects could include bruising or excessive bleeding. The furosemide is a diuretic, and it's used to reduce edema. Some side effects is going to include headaches, dizziness, or constipation. The potassium chloride is used to treat low amounts of potassium in the blood, and some side effects could include some abdominal pain, nausea, diarrhea, and then also we have the liquid acetaminophen, which is used for the treatment of aches and pains or fever. Some of the side effects could include some dizziness, coughing, nausea. You could get some hives. We do ask the patient to report any adverse side effects they might include, which could include, the nausea, the vomiting, having any painful or difficulty swallowing, black stools, trouble breathing. I'll also ask the patient if they have any questions. All right, so at that time, I am going to perform hand hygiene. I will place on my clean gloves. My patient is going to be in a sitting position. I will be giving them water, as that is their preference. I'm going to prepare their medications at the bedside, verifying the name of the medication on the labels with the patient's name as my third check, just to make sure. At that time, I would also perform any of the pre-administration assessments if they were needed, which could include checking the patient's EHR, for their PT or INR ranges. You might want to check the patient's blood pressure or do an EKG. You could check their liver function test results just to make sure everything is in range. At this time, I'm going to place all of the medications in 1 cup, as the patient prefers to take them all at once. All right. I will thoroughly mix our liquids prior to administering them, and I'm going to place the cap upside down on our work surface, and I'm going to hold the label of the bottle against my palm while pouring. And I'm going to pour it carefully, making sure that I don't spill anything anywhere. I'm going to use a little napkin here to clean up any mess that we may have around the neck of the bottle. And then I will recap the bottle. This time I'm going to be giving my patient their medications with their water. Then they're going to take their acetaminophen, which is going to be the 500 milligrams per 15 ml as well. I'm going to ask the patient if they are comfortable or if they have any questions. I'm going to make sure everything that they need is within reach. I am going to clean up my mess. I will perform hand hygiene, and then I'm going to document everything in the patient's chart. Thanks.